The medical humanitarian organization, Doctors Without Borders, has responded to the Jabalia refugee camp attack. Right now, we're joined live by Joseph Beliveau, Executive Director of Doctors Without Borders Canada. Doctor, this is our second time speaking. First off, let's get your thoughts, your reaction to what just happened.
So when I hear the words, it's hard to come to terms with the fact that this bombing was justified on the basis of military necessity when my colleagues, Doctors Without Borders, doctors and nurses in Al-Shifa Hospital have been receiving the wounded from the strikes, which the majority of whom are women and children, with severe wounds, burn wounds as well. Some of them arriving at the hospital without their parents, completely lost, wounded, and bewildered. And there's no justification, certainly not in international humanitarian law, for a bombing that is so indiscriminate that it affects civilians, including women and children, to this extent.
Okay, so let's back up a little bit. The last time that we talked, there was the issue of having to evacuate hospitals. Medical staff and patients, they were still in those hospitals. How are they doing? Do you have any idea of their status? What's going on there?
They're terrified. They're overworked. They're never quite certain when the next airstrike is going to hit. In one hospital that MSF has been supporting, the Turkish Friendship Hospital, as of today, that hospital is no longer functioning. 2 days ago, the third floor of that hospital was hit by an airstrike. That combined with other attacks on that facility, as well as the running out of fuel. There is no more fuel in that particular hospital. So this was a hospital that treated, it was Gaza's only cancer treatment facility. This means that cancer patients will no longer have treatment. Many of them will perish. It was also a mental health care facility. That hospital is completely non-functioning now. One of my colleagues, a surgeon, wrote on the board. There's a board that is normally reserved for scheduling of surgical interventions, and he simply wrote on that board, "We did what we could. Remember us." And a number of our colleagues are sending photographs and sending messages, anticipating that it could be the last time they're able to do that. So the pressure, the fear, working without supplies, working without fuel, is just causing almost an undescribable pressure situation.
Okay, and along those lines, remember the last time that we talked, there was all of that aid that was sitting in Egypt that could not get to those doctors and nurses who needed it because the Rafah crossing had not been open. It has just opened, just now. How soon do you expect to get some of that aid to those people who need it?
Well, maybe in terms of volume, certainly if that crossing is now wide open and can accommodate the level of aid needed to come in, then we're hopeful. So far, what we've seen over the last week or so is the number of trucks has been a tiny fraction of providing the food, the water, the medical supplies. And remember, in the hospitals that are still functioning with MSF and Doctors Without Borders staff in there, we're out of gauze for wound treatment. We're out of painkillers. We're out of blood for the wounded. The most basic medical supplies are already out. And this is in a context where, there's no access to clean water, at least in the whole northern part of Gaza, no access to clean water, the fuel, of course. So what has been coming across that border over the last week is a tiny fraction, and what would be necessary to now start mounting a proper humanitarian response is hundreds of trucks a day. But remember, even if that were to happen, the bombing is still happening. I just described, you described Jabaliya camp bombing a couple of days ago. A hospital was bombed that we've now had to close. We can't function in those circumstances. So MSF has taken the very unusual step of going out calling publicly and unequivocally for a ceasefire, because the way that this war has been conducted is with complete disregard for non-combatants or civilians, contrary to the Geneva Conventions. That's why we're calling for a unilateral ceasefire in this case.
And with the simple words of "we did what we could." Joseph Beliveau, Executive Director of Doctors Without Borders Canada, I thank you for your time and your work.
Thank you, Bakari.